Good afternoon, everyone. My name is Greg Weimer. I am Director of International Students and Scholars on campus. We are welcoming you to the International Rams Campus Kickoff. This is a new initiative where we're going to have 6 sessions over the next 6 weeks to really introduce you to some of the services across campus, as well as introduce you to campus partners. So today we have the CSU Health Network that is here to present on various services that they provide. And so a couple housekeeping things. If you're online attending, please feel free to put your questions in the chat and we will actually monitor those and be able to basically relay those to our presenters. And so we're going to go with that. But with that, I'm going to introduce Lynn Buck. Lynn, you want to come on up? Start chatting a little bit, and if we can share the PowerPoint, that would be great. We're ready to go.
Okay.
Thank you. Yeah.
Well, thanks for hosting the Health Network today. We're really excited to be here. We have staff here representing all parts of the CSU Health Network, and in a minute we'll go through and everyone will have a chance to talk about their area. And if you have any questions, feel free to ask them, or like Greg said, put them in the chat. So my name's Lynn Bunn. Again, I use the she, her pronoun series, and I manage the student insurance department at CSU. The areas that I can talk to you about today would be if you wanted to do a waiver with other insurance, have any questions about the student health insurance plan, or how co-pays and deductibles insurance works within the CSU Health Network student plan. So I'm going to give you a brief overview of the CSU Health Network before we bring our experts in. No.
Right.
So first, the CSU Health Network building is the building on the corner of College and Prospect. It's on the far, I'm going to give me directions here, southeast corner, southwest corner of campus. Is that right? And we host, or we have in the building, we have some third-party partners who are not part of the health network. So a couple places on the first floor. It's kind of important to know, especially if you have a student health plan, because the UC health partners in the building do not participate. Well, they are not part of the CSU Health Network. So the benefits for students on the student health plan are a little bit different there. So also on the first floor, we have our CSU Health Network pharmacy and physical therapy department. Second floor, we have our medical services, including immunizations, optometry, and lab. And then on the third floor, we have our counseling, psychiatry, dental clinic. I missed anybody? Okay. So being new to campus, just so you know, we are on campus. We're at the very far end of campus. And you can find us again on Lake Street, College Avenue, and Prospect Road. Okay. So all students who are at CSU have access to the CSU Health Center. So you don't have to have the student health plan to be able to use the health center. You can bring your own insurance, and we will bill insurance, and we have an expert here who can tell you a little bit more about that. We have over 200 providers in the building, and so any kind of service that, well, let me put it this way. If you're not feeling well, whether it's emotionally or physically, you are welcome to come into the health center. You can walk in, you can make an appointment, and you can be seen. So if you're taking classes, you are you're part of being able to use the health center. So like I said, we have medical, mental health, health education and prevention services, our outward focused services, and you will see those staff members on campus throughout the time at CSU, providing promotional information about wellness and education about different wellness initiatives. And then their business services is last, and that's our area with student health insurance plan, medical billing and coding and our medical records department. So, any questions so far? Okay. So medical services, I'm going to hand this off to Terry. Alrighty. Give us a little overview of the area. Yep, go right ahead. I don't have anything prepared. So we're gonna just kind of go off the cuff a little bit. But I'm basically representing kind of the second floor at the health center, and that's comprised of like the primary care clinic, which we see just same day visits. We can see chronic patients of people with conditions that they want to be seen by the same person over and over, or if they need to be seen for the same condition over and over. And then there's also a walk-in clinic that we call the acute care clinic. So if you have just an immediate need, if you're ill that day, injury, you can be seen that same day, just walk in, they can put you on the schedule. Sometimes there's a bit of a wait for that, because as you can imagine, sometimes we get a little busy, but we try the best we can to kind of keep that moving. Or you can make an appointment in the primary clinic, and then down the hall, we have a sexual and reproduction health clinic that focuses on like gender and women's issues and anything in that realm. So we try to kind of encompass anything you might need, and we're just here to help the students be really healthy and successful at your time at CSU. We also have some specialty services that come in from outside, like we have an orthopedic physician that comes in once a week to work with our physical therapy department, so we can refer to them, and you can use your SHIP CSU insurance with that. We actually have optometry, physical therapy, physical therapy on site, but allergy and asthma. We used to have someone come in. Right now we don't have anybody, but we're hoping to maybe get them back in the future. But we do have an allergy clinic in our immunizations clinic that does allergy injection, things like that. So there's a lot of care to be had at the health center.
As far as dental, is there actually a dental clinic?
There is on the third floor. So that's just a general review. We do have the lab on site, so we can do same day labs for many things. There's a few things we have to send out. We had X-ray on site. Right now we do not, but we can send people out for X-ray. I've got a couple of locations in town that are lower cost, and it's pretty reasonable. We used to share X-ray with the clinic that was downstairs, and we're hoping to get that partnership back, but right now we're not set up for that. So it's the only thing we can't quite do right now on site. So, any questions or anything? Half the time. Oh,
Hey y'all, I'm Drew. I use they pronouns. I'm one of the counselors at the CSU Counseling Center. I'm also here for psychiatrists, but I guess I'll talk a little about that too. We have quite a few services for mental health. So a lot of things from like one-on-one therapy to group therapy, workshops, being able to navigate like medication as well when it comes to mental health needs. Yeah, so a lot of what it might look like would be for students to come in and for the walk-in session or like an OCC session, kind of gather information like what kind of resources we can provide you, be able to set you up with like what best suits your needs as a student. So generally we go with like a brief individual counseling model. So shorter term sessions, plenty of therapy groups. So if you're ever unsure of whether or not like a need might be met by a therapy group, we might actually have that. We could have like an international specific like support group. And it doesn't necessarily have to be specifically therapeutic. We also have support groups and identity-based groups as well. Lots of skill building workshops. So if you feel like some working on like some of those anxious feelings or some stressed out feelings would be helpful for you. we've got workshops for that too. We work pretty closely with psychiatry and being able to like meet students' medication needs, whether that's bringing in medication from like outside providers, work with providers and figure out like what that might look like, bringing prescriptions from different countries, that too, as well as like starting medication and what that might look like. We've got things like day programs, so navigating what drugs, alcohol, and different aspects of like substance use might look like for you. That is based on like your comfort level of like how you would want to approach that. And post-hospitalization support. So even though we sort of like focus a lot on brief counseling, we do some more intensive therapies as well. And those walk-in clinics or the walk-in sessions can also be utilized for like crisis like intervention. So really intense things are popping up for you. Always feel free to walk in during our hours. And that is a great way to handle some of that too. These are some main pieces. If therapy is feeling a little intimidating, we also have some services that are not quite therapy, but kind of meet some of those needs, like our multicultural counseling hours, where you can walk in and sort of sit and explore some of those pieces too.
So one quick question, because we have a lot of students that actually come from cultures where counseling is taboo. So maybe kind of address kind of the cultural norm here in the United States, basically the importance of being mentally well and what that means, so to speak, and kind of how just to encourage our international population to use this, I think. So
yeah, absolutely. Yeah, no, especially speaking to the like intimidation factor. A lot of times we think of mental health services as like you're falling apart or having like all of these negative connotations to them, but we definitely like to approach mental health and those services as just as important as your physical well-being, and if anything, they're very much intertwined. So being able to thrive with your mental health is really important. To be preemptive with your mental health, right? If you know that you're going into stressful situations, which college does that, can be really helpful to be able to navigate those pieces. And coming from like different cultures where mental health can be synonymous with like some of those like heavy stigmas, we definitely want to create a lot more access to thriving, right? So yeah.
Oh, well, it's my turn. Fun buzzwords person. So my name is Joe Kelly. I am the billing and coding manager for the Health Network. Some of that in itself is kind of a strange area for anybody to approach at any point in their life. But we do bill insurances for our services at the Health Network. All the services that Cherry has presented to you, we will bill insurances for out of a courtesy to you all. The only things that we don't bill for, of course, are going to be the dental services at this time and some of the optometry care. We strictly look at the mental health, the psychiatric care, and we look at the medical billing portion of things. We have two different areas been presented for the SHIP department, which is the internal insurance that they have. I deal with all of the commercial insurances. So if you have an insurance like United Share Services, which does take care of a lot of students, international students. They have a resource, United Health Service resources that we will bill for your services if that's the insurance that you have. We're not necessarily in network with all insurances, but we have a good range of insurances that we can bill for your services. And we do attempt to let you know if we're going to have any problems with that one portion of things. So as you can see, we've got the substance misuse prevention, mental health initiatives, peer education, well-being initiative, and sexual health initiatives. In the business services, like you've heard, we deal with student health insurance, private insurance, which is me, commercial stuff,
We have the Ram Care Supplement, which is also managed by Lynn's group. This extra supplementary insurance that they have within the health clinic that allows students that have high deductibles to get a little bit of financial help through the Ram Care, and they'll pay for those services that insurance don't pay for. And then we also have the medical records. It's a big department we have, because it's not just around the medical portion of things. We have our HR department that's there. Our housekeeping department is part of the business services, and we have our accounting department. So we're a huge clinic with a lot of services that we provide for the clinic. Next. Again, private insurances, we'll build those insurances. Also, we ask is most students to just be aware of what their plan covers. So we always recommend that if you have a commercial insurance, that you contact your insurance and ask them if you're in network with us, and if you're going to be able to get coverage when you're coming to us. Otherwise, they can end up being everything financially in your pocket if you don't check these things out. The other thing with the student health insurance, I think we're just going to keep going over and over this again, but it is a health plan. It does go through Anthem Blue Cross Blue Shield. So when you're not on campus and you're seen off the campus, Anthem Blue Cross Blue Shield will be billed for those services that you were seen for, and they'll have a deductible that's a part of that. And there are some co-pays and co-insurances that are a part of that also. Hello. Billing is it's a strange beast in itself, because we deal with insurances and we have to deal with their policies and what they want to do for you and your plans. But our department is there to kind of help cushion that and give you more support and information on what the processes are. We do that financial piece. You're seen by our clinic. We build the insurance for you. We get the explanation of benefits back for you. We process the payments or the statements that they provide for us. Then the extra financial things like co-insurances, deductibles, co-pays will go to your student account. So you'll never get a bill from us, which makes me happy. But it is a different world, and believe us, we're here to support you, and we'll do whatever we can. So just if you've got questions about insurance billing, just give us a call. We'll help you out. Okay. Any questions? Can I rabble? Okay.
I have a question.
Sure.
So what does, when it says like co-pay or co-insurance, what is that? Sometimes they give you a percent, sometimes they give you a number. What is that?
So it really depends on your plan. So wherever you're buying from the insurance, they're going to determine the rates that you're paying. They're going to be determining if you have like a deductible, which they say is an out-of-pocket expense. So the deductible, they have it up to a certain dollar amount threshold. And then after that, then they take it to a co-insurance, which is just a percentage, a smaller percentage that you owe. And then a co-pay is just an out-of-pocket expense that you can take care of right then and there that you're being seen for. I'm not the best person to explain these things, even though I am the billing and coding manager, but it really does depend on your plan and what you're purchasing. So it's a good idea to know the plan that you're getting to determine what's going to be, you're going to be paying out of pocket of that.
So he does have ship, so.
Oh, well,
And I'll go with that again later.
Okay.
yeah, that's this.
All right, so before we move on to.
There we go. Try it again.
There we go. Before we move on to the recommendations requirement section, we have two departments that weren't included in these slides, so I'd like to ask Michelle if she would come up, and then we'll do dental after that. So Michelle is with our pharmacy department.
Yes, happy to be here. Nice to meet you. My name is Michelle Brown. I'm a pharmacist, and I'm also the pharmacy manager at the Health Network. Our pharmacy is on the first floor, so pretty much when you walk in, we're the first thing you're going to run into. We fill prescription medication, which some prescriptions may be different than what they are in other countries. In some countries, you can walk in and just purchase it, whereas in the United States, you may have to see a provider, like a doctor, nurse practitioner, or physician assistant in order to get that medication. That provider then sends the prescription to us through the computer, And then we get that ready for you and we bill your insurance on our end. So while Joe's team is taking care of the medical side, pharmacy does their own billing for prescriptions, and it is again plan specific. And so when the prescription's ready and you come pick it up, you'll be asked, do you want the pharmacist to go over your medication with you? If you say yes, a pharmacist will come over and tell you everything you want to know about what you're about to take and answer any questions that you have. In our pharmacy, we also have what's called non-prescription medication, or what we call over here over-the-counter medications. Those are things like Tylenol, ibuprofen, medications for allergies, first aid, things like that. Whereas say you have like the flu and you don't feel sick enough that you need to see a doctor, but you just need some help with the symptoms that you're having, like a cough or fever, you can come in and see the pharmacist without an appointment, and we can help show you what's available and help match that medication up to how you're feeling to hopefully make you feel better. If you are feeling really sick though, we definitely will recommend that you make an appointment with a provider, but most things like cold can be managed without prescription medication, and we're here to help you make the best choice. So that's pretty much what we do down in the pharmacy. We are always available by phone, so give us a call if you have any questions. You don't need an appointment at the pharmacy. You can always call us or stop in.
Hi, my name is Arlie Burnham. I'm a dentist and I'm the manager of the dental clinic. What we provide is most dental services. There's a couple of things we don't do. We don't do a lot of really difficult wisdom teeth. We don't do any kind of root canal stuff, but we do cleanings. We do gum disease things, fillings, crowns. We're located on the 3rd floor, but it's pretty straightforward. Just like with everyone else, we don't do the insurance, but we will provide the insurance information if you have private insurance. Just like with the ship, it bills under the student plan as well, just like the other medical stuff does. But yeah, basically we do emergencies. We're a little out on cleanings, but yeah, when you call, you can just call, make an appointment, and yeah, that's really in a nutshell. Any questions?
With the dental services that we provide, does it tend to be a little bit cheaper through the student health center versus a dentist within town? Or
Yes.
That.
Solid, yeah, it is discounted for sure for the students.
So your recommendation for our international population would be stop by the health center first with our.
Yeah, definitely. I mean, in student money can be tight, so absolutely, it's definitely discounted. We'll do things sometimes that private people won't do, as far as kind of letting certain things go and just making sure that things are financially good for students. Yeah. Cool. Thank you.
Good afternoon. My name is Beth Early and I work at the immunizations department as the manager. Our department's on the 2nd floor, located just to the left of the elevator. Hopefully we'll see you guys during flu season because we carry a lot of the vaccines for adults. We also carry the flu vaccine, but we're also where if you haven't met your requirements for immunizations, you'll probably need to come see us so we can work out what you need to do. We also have an allergy clinic there, and so we give allergy antigen. We don't do allergy testing, but a lot of people have been tested outside and bring their serum into us. And then we can give the allergy antigen then. So for our area, the requirement are that the international students and all students on campus have 2 measles, mumps, and rubella vaccinations. And so part of the responsibility is to submit your records to us so that we can review them and make sure they're compliant with our requirements. To meet the requirements, our records have to be given on or after your 1st birthday and given at least a month apart. A lot of time we'll get records that were given before your 1st birthday, and unfortunately, according to Colorado law, we can't count those. And so we like to take look at the records and input them into the pyramid, and the pyramid runs logic so it can tell you if your record's compliant or not.
The other requirement we have is for meningococcal vaccine. And that is for everyone living in a residence hall. It has to be current within the last 5 years. So what that means is from your matriculation date, the vaccine has to be given within 5 years before you start school. And it has to be a particular kind of meningococcal vaccine, which is called ACWY. A lot of times there's a couple other different strains of that vaccine, but we have the one we want is that particular ACWY vaccine. So to submit your records, you need to log into the CSU Health Network portal. And the website is thehealth.colostate.edu. And under quick links, you can click on the student health portal. Oh, got your so with these slides, this is where you log into the health portal. So you will log in with your e-name and your password. And then it's kind of tricky on this page because you can see there's a link that says pending form. That's not very big, but that's what you'll want to click on next to upload your immunization records. You can also upload records under document upload. That's another place that you can upload records. If you submitted something already and you forgot to submit something, then you can upload it through the document upload. When you submit your records, give us about a week to look at your record, and then you can log back in here to see if you're compliant or not with your immunization requirements. So you can see the top one is green, so that's how you can tell if you meet the requirements. If it's red, that means you still haven't met the requirement. So you can always give us a call and we can help you navigate what you need to do to meet the requirements. We have same day appointments, so you can usually get in pretty quickly if you need to get your vaccines done. And you just need to call the main number, the 491-7121 to make an appointment. We generally request that you make an appointment, but usually we can get you in right away. Do you guys have any questions or anything about the?
So sometimes I'm asking something on students, but if they are not compliant with one of those vaccinations, does a hole go in their student record? How does that work? So
Yes, so we give you a little bit of time to make your records compliant. So we'll usually put the holds on so you cannot register for spring semester, usually at the beginning of October. And so students should be getting emails. So we've been sending emails throughout the semester if they're not compliant. So we really encourage students to also log into their email if they haven't done so, and it will let them know if they're compliant or not. Their records. Any other questions? All right.
Hi, my name is Sarah. I'm one of the nurses in the immunization department as well. And in addition to what Bev has said about the requirements, we also want students to know that we have many vaccines that are available. If a student doesn't have records or if they're not sure if they're up to date, we can, give them that hepatitis B series or the HPV series that they weren't able to get, or their tetanus booster. So all of those services are available at the health network. Oftentimes students come to see us because of the requirements, and then they learn like, oh, I can also get these here. And so we end up kind of seeing them over time or getting folks caught up. The piece that I wanted to talk briefly about is the TB or tuberculosis assessment. The first question we get is this a requirement? So there will be no hold or anything created if this piece is not done. But we really want to emphasize the importance of doing the TB assessment and emphasizing the fact that we can offer the testing here if you do have one of the risk factors for TB exposure. And so tuberculosis is the world's #1 infectious disease. About a quarter of the world's population will have been exposed at some point in their life and have a positive test. We really ask that students go into the student health portal fill out that assessment form, which will tell you if you have any answers that are yes. Are you someone that, for whom we would recommend TB testing? Many students get the testing done in their home country and then upload that. That's perfectly fine. But we do have the option of doing the TB blood test through the health network. And we would encourage students to kind of see it as an additional benefit, not so much as something I have to do, but something that is encouraged for them to do for their future health. To find out, hey, have I ever been around TB? Would I be a candidate for TB preventative therapy? Just looking at some of those cultural pieces, the way that we approach TB in the US is a little bit different because we don't have so much active disease. We can really focus on inactive or latent infection and offering treatment to prevent disease in the future if someone has it. So we just like international students to know the TB blood test is a covered benefit of your student health insurance and most other private plans as well. We offer then the follow-up care, and we can talk about medication treatment for that. It's a little bit of a different approach than many students will be coming from, whereas in their country of origin, they only focus on active disease. It's like, we're not going to worry about inactive. It's not causing a problem to anyone, but that is our plug for please doing the TB assessment. Please asking questions if you have any about the follow-up, and we're here and we're happy to help. But I think that's about it. Let's see, what's next? Do we know? You're next, okay. All right. Good now.
Okay, so I'm back again. And now I'm going to talk a little bit about the student insurance and the requirement to provide proof of insurance to the university. So many of our international students will have a student health plan, or they may be sponsored. A few students, international students, may have a spouse or a parent have a US based maybe an employer plan that that meets our requirements for the waiver, but most students, international students coming to CSU, are going to be on our student health insurance plan. So I don't know that I have a slide. Oh, look at that. I didn't know it did that. So most of our, I don't necessarily have a slide specifically on the student health plan, but I will talk through that. At the CSU Health Network, students on the student health plan have no deductible to meet under their plan, but they do have small copays. So if you have to be, if you go in for an appointment with a medical provider, you'll have a $10 copay. You have labs run, it'll be a $5 copay. If you have go to physical therapy, that's a $15 copay. And in the pharmacy, if you're picking up a prescription, it'll be a $5 copay. But all the rest of the cost of that service is going to be covered under your plan and paid by the plan. Okay. If you're seen outside of the health center, the health plan is an Anthem Blue Cross Blue Shield plan, and it's a PPO, which means it's a broad network of providers. And I know that people coming from other countries, that what we're saying may not really resonate because it's not how healthcare is done in other countries sometimes. So we are always available Monday through Friday, 8 to 5, for you to walk in and ask questions specifically about how is this going to work if I'm going outside of the health center. We also have a referral coordinator in the health center. So if you're seen at the health center and all of a sudden the doctor recommending you go outside, our referral coordinator will sit and talk with you and help you find providers that are in your plan network. So if you're on a sponsored plan, same thing. You can sit with the referral coordinator, Carrie, and you can walk through kind of how much might this cost me, where would my plan work best, and we're just we're available to help with that, because we know this is very different than what you're coming from. So the student health plan specifically has a $500 deductible when you're seen outside of the health center. So that deductible is what you pay before your insurance starts to pay, and it's a one-time-a-year dollar amount. Once you have met that, if you have services beyond that $500, you'll pay 20% of the cost of that care. And then, there is a maximum amount that you could pay through a plan year, I think it's $6,850. And that would mean you'd have something catastrophic, hospitalization, major surgery to actually meet that dollar amount. So most students aren't going to meet that. But to say there is a bigger cost to be seen outside of the health center. And so most of your care, if you can start it at the health center, that's great. And then if your provider says, no, we really do think you need to be seen outside, that's what you can expect, is there's gonna be more costs, but you know, our providers will do what they can here at the health center for you, and then if necessary, send you out. There is a deadline to either provide proof of insurance if you have other insurance, or to be enrolled in the student health plan. All international students coming in with any credit levels are automatically enrolled in the health plan unless they are sponsored or they provide proof of other insurance that meets the requirements in CSU. So sponsored students, if you have a sponsor letter that includes health insurance, you should turn it into the International Programs Office. And I don't know exactly who here, but at that front desk, they'll be able to direct you. Christy. So, and that will make sure that you're not doubly insured, okay? And then students with private health plans, on our health network website, there is a international student insurance waiver page that you can fill out a form and submit that. Any questions about? Yes.
For example, if this situation where I have to go outside of the, like, here to like another medics, what information will we bring with us, or like insurance number, how does that work?
Yeah, that's a great question. So once you've been enrolled, and probably at this point in time, it takes a little bit of time for the point that we enroll you for the Anthem Blue Cross Blue Shield to get you in their system. But most students at this point in time already are in their system if they're going to have our health plan. So you would go to anthem.com/register. And then you would fill out and create an account. And the ID card is in that account. So you can find providers if you wanted to do it on your own. You can see how much of your deductible you've used. And then of course your ID cards are going to download onto your phone. If you wanted a hard copy, you could call the Anthem Blue Cross Blue Shield number, and that's on our website as well. And you could ask for a hard copy, and they will mail it to you.
All the information's on the website, correct?
Yes.
And can you talk to, let's say they go off campus to a different provider and they, of course, get a bill. A lot of times we get international students that start to panic because they see this large amount that they owe. Typically in the United States, what's possibilities of paying that over time, kind of give them kind of a perception of don't panic.
Yeah.
You know, that kind of thing.
Yeah, that's a great question, Greg. So one thing I know, I see some students come in and they've got a bill from the provider or the hospital, and they're like, what do I do with this? And first thing is, don't pay directly. Don't pay when you get the bill from the hospital, because you're going to get an explanation of benefits through your insurance. Okay. Say this, and it's gonna sound convoluted, I know it, but there it is. So let's talk about our hospital system. So like UC Health Hospital, they will charge, let's say, $800 for you to be seen in the emergency room. They will send that charge, they will send a bill to you and say it's $800. Now also, if you give them your insurance card, they will send it to the insurance company, the Blue Cross Blue Shield. And if they do have a contract with them, then Anthem is going to say, oh, our contract says you can only charge $500 for this service. So there's $300 off right away. And then the student has already met their deductible, so they only have to pay 20% of it. Do you want to wait for that explanation of benefits from the insurance company that you can see on your Anthem portal? Or wait until you see that the hospital has shown that the insurance has responded and that they've discounted it and that you know what you really do owe. And you can always bring that in. We talk to students about this all the time because it is not straightforward. It just isn't. But,
Piggyback on that, I've had some students who have had emergency cesarean surgery, like sinus, heart surgery. And the hospital is really good about doing things with them, and it wasn't as painful as it initially seemed. As far as the, I can't promise that for everybody, but my experience has been that they were.
yeah, yeah. And when you do get that bill, there is always a phone number. Always call and say, how can I break this payment up over time? And can I set up a payment plan? And they will work with you. So the other requirement that CSU has is for the students to complete the alcohol EDU. And that should be in your inbox, and I believe is already due. Well, it's already been due. So if you haven't done it yet, it's a module you have to take. It should be in your CSU email, and you need to take that. I know today. Yeah. Okay. Yeah. So you'll have a hold if you don't take care of that. Campus financial wellness is an optional component, and that is also on our website, but you can go and, well, there's you at CSU, there's all kinds of resources on the Health Network's website, which is health.colostate.edu, and you can use a lot of wellness resources on that page. So. After hours and emergency care. Okay, so CSU Health Network is a Monday through Friday, 8 to 5 facility. Tuesdays we're open at 9. So anytime after those hours, we are not open, but we have a nurse line that you can go to first, unless it's obviously if it's emergency, do something different. But you can call the nurse line and talk to them about whatever's going on with you, and they'll give you some recommendations. There's also a mental health crisis intervention number. And then if it's urgent, emergent, and need immediate services, on our website, there's a list of local services available. Any questions about that? What's to talk about?
To think like encouraging, urgent care if possible, because the emergency.
Or that's that a great point. Yep. In this country, the emergency room is your most expensive option. So if you can go to an urgent care center, that's going to be your best bet. But obviously, if it's a life-threatening emergency, you need to go to the emergency room. Here's our Health Network phone number. That's to make appointments. You can call for other questions to that phone number. It's the website, and again, we're on Lake Street, corner of College and Pratt. Thanks for having us. Do you have any questions we can answer before we go?
Is it true that you cannot schedule 2 appointments on the day? So it depends on the care that you're receiving. We have a gynecologist, she's an OBGYN. So if you schedule an appointment with her, you're going to be able to see her. And then if you want to go see a doctor for a call, see that, because we have her contracted as a specialist, but it'd be considered to be separate visits. We don't like to have you see 2 of the same type of providers for those visits, because insurance won't waive that. They'll flat out deny it at that point. So yeah, it just depends on the type of care that you're looking for. If you want to do physical therapy and then go see your doctor, you can do those 2 types of visits. And maybe 2 different calls that go within a contracted differently, so find investments.
Is there a way to know the cost of like the dental services at the health center?
I missed the dental department.
No.
We did do insurance, but we didn't have insurance.
So I've got it on Zoom.
It's an insurance plan, does have a dental plan on it, so even though the dental department doesn't bill private insurance for dental services and they give you a bill with the student health plan, there is a plan and it is billed through the health center, so you can use the dental plan at the health center or in the community at $1,000 annual benefit, 2 cleanings per year with no cost to you, so x-rays and cleanings. And then 80% covered, 20% your responsibility for minor restorative, which would be like the bill, right?
Basic, for basic services, they're covered at 80%. So that's your billings, also root canals, which we don't do those here. We would refer you out to a specialist, but those are covered at 80%. And then major things would be considered crowns, night guards, dentures, implants, things like that.
And those are covered at 50%. And that's up to like the annual $1,000 max.
If you have a what if it were just like a cavity, like cavity and saying just kind of a typical run-of-the-mill cavity that's filling?
Yeah,
So price point that's close around.
so if we have a student that comes and maybe saying that they're having pain on their right side, we will see them, we'll do a brief examination called a limited exam. We'll also take possibly 1 or 2 films. So Dr. Burnham and our other dentists can diagnose. Once that's determined, if there is a filling that's needed, this was what I wanted to share too. We always give treatment plans at the dental office. So as long as we do know ahead of time that you have student dental through SHIP, we're able to apply that insurance into our dental software. We will present a treatment plan to you that will estimate what insurance is going to cover with those percentages and what your part will be.
So if it was like a billing.
Well, so with the filling, it's gonna depend on the size of the filling as far as what the fee would be. So if it was just the 1 surface filling, or if it was a 3 surface filling, so we determine all of that, and then I guess that's what I mean by we give the treatment plan to you, so you're advised of the cost before you decide to do what you want to do.
We also have on our webpage, we have a list of all the, well, not all, but a majority of the services that we provide and has the prices that we build those to. So you can pop in there. I think we do have some demo codes that are in there, medical labs, all those, just for the transparency of costs. They're available on the website.
This is health policy.
Yes.
And for the fees, you go far right to about the current fees and eligibility. Link at the very bottom of the page. Great. Well, thank you, Greg, for having us.
Well, I'll jump on screen for the people that are online. So, as we continue this series over the next 5 more weeks, one, continue to look for emails from our office. We'll continue to send you reminders. CSU Health Network, all of you, thank you so much for coming and really providing kind of an overall idea for our international students, how insurance works, kind of really where they can get care, healthcare. Our health system is known to be throughout the world to be complicated. And so with that in mind, know that you have a group of people on our campus in our health center that are specifically here to help you navigate the system. And so that's, if you take anything away from today, take away the fact that you have a wonderful health center on campus, and they will be willing to kind of step alongside of you and help explain the healthcare system to you as you have questions. So we thank you for your questions. Thank you for attendance, those of you online, and those of you who tuned in after the fact, because we recorded this. The information that was on the screen at the very end in regards to the health network, CSU Health Network, contact information is right there. And so you can give them a call or email them or stop online and it will definitely help you out. So thank you all and have a wonderful evening. So thank you.